Good morning, everyone, and thank you for joining today's webinar. I'm Anne Livingston and I'm the Chair of the Community Care Smart Assistive Technology Collaborative. I'm the moderator for today's webinar, and today's webinar has a focus on developing living labs for community care, outlining the opportunities for co-design and co-creation. Our webinar today is facilitated by Community Resourcing for the Community Care Smart Assistive Technology Collaborative. If you've joined us in previous webinars, you'll know that they are designed from feedback and requests we receive through the collaborative. The focus of our webinars is to bring together local, national and international perspectives in research and development, as well as the deployment of smart assistive technology in the community care sector. Just a reminder, if you haven't already registered for the site, it's accessible and free to all. Register at the site is easy, and I'd encourage you to do that. Just a reminder also that neither Community Resourcing or the Department of Communities, Child Safety and Disability Services are promoting or endorsing any particular product, research entity or organisation. The purpose of our webinars is to serve and to inform viewers of various smart assistive technologies currently in deployment, in research or in development. We welcome any questions, but just to let you know that you're on mute, and if in the interest of recording, your questions can be added to the question pane to the right of your dashboard, and there'll be an opportunity for your questions to be answered at the end of the session. In all previous sessions, we've been inundated with questions, so the earlier you post your question, the more questions we'll be able to respond to during this session. In this webinar, it's my great pleasure to welcome Gareth Priday. Gareth will introduce living labs and how this development and concept is being used in community care, as well as the opportunities for co-design and co-creation. This webinar will focus on the ongoing role that those living labs can play in innovative service delivery, seeking to identify and provide an understanding of key considerations in respect to implementing living labs. Gareth is a foresight practitioner and researcher. He holds a Futures Research position with the Queensland University of Technology's Smart Services CRC, and has published in the Journal of Future Studies and presented at a number of Futures and Innovation conferences. Gareth has a Masters of Strategic Foresight from Swinburne University and a career background having experience in financial service sector, working for large international banks both in the UK and Australia. It's my great pleasure to welcome you, Gareth, to today's presentation.
Thank you, Anne, and thank you very much for the invite. And whilst I've got the opportunity, I'd just like to thank Anne and the team for all their support over the last couple of years for the Australian Living Labs Innovation Network, on behalf of whom I'll be representing and presenting today. So we're going to talk about living labs, but I'm also going to take a little bit of a divergent route to get there. And as Anne mentioned, I'm also a foresight practitioner. I'm going to start with a little piece around that. So one of my favorite anecdotes from is about a practitioner in Germany who engaged with a German youth with a survey around the future, what they thought the future was going to look like. And they came back with lots of kind of bleak, kind of dystopian futures. And then we ran a workshop with them, and all of a sudden, you know, the future was empowering and interesting and, you know, something that was very exciting. So you asked them what the difference was, and they said, in the competition, we were asked for the kind of future we expected. Here, we're being asked for the kind of future we want. And I think that's a really important starting point to think about when we get onto living labs, is what's the kind of future we want and how do we get there? And of course, we hear lots of different ideas about the future. So we hear things about electric cars and driverless cars, or robots, or 3D printers and how they can be used to, in this case, produce bespoke slings. Or we might think about the redesign of our cities, so the greening of cities. We might see images like this, or something more modest. So this is a kale farm built out of recycled containers in a city. Perhaps we think we're all going to be unemployed because the AI will take over. Of course, this is a recent AI beating a champion one of the most complex games. Perhaps we'll all have our yoga poses better because we can have Internet of Things connected to our clothing, and this will guide us in how we should behave. But perhaps on the other side of things, the future is without chocolate owing to climate change, without wine or coffee. Perhaps we can't rebuild our cities because things like sand are running out, and just alongside things like rare materials that are used in our technologies and phones. We have problems with no bees and what that means to production, changing weather patterns, and perhaps we all need to end up downsizing through gene changes. So the problem we have all these things that are kind of emerging, and the conversation with the future is constant. So for example, there are lots of things I haven't mentioned there. Perhaps I should have put blockchain in there as well to be topical. So there are no future facts, and we have lots of contradictions in the way we think the future might unfold. And we know that with these different emerging technologies, that there are wicked kind of messy cascading effects. They impinge on one another. And the ideas that we have don't necessarily mean they come to fruition because we have unexpected consequences. And what about culture? How do these things apply in different cultures, whether we're talking about the scale of a country or a city, or even talking about the scale of something like an aged care centre? And what does that context mean? What does geography play a part? And the physical context and spaces that people are using these ideas and technologies. In future, sometimes we use this 3-horizon model that was developed by Curry and Hodgson to kind of describe how we might think about these changes. So we might have a situation with a very high strategic fit to start with, and over the long term, we think it's not going to work, which could be, for example, we don't think coal-fired power stations are going to be great over the long term because we're worried about climate change. And then in the short term, we have these ideas that start to emerge around, if we went back many years, it would have been around renewables, and we might have images of all renewables, but other people might have images of just nuclear power, for example. And in this middle bit, there's this messy battle of ideas and transitions and events that come to kind of partly create the future. But there's also innovation. This is the space where there's lots and lots of innovation going on. So if we want to kind of create the future, a preferred future, the future that we want, not only do we need to think about that and think about all those things that are going on and what do we really want from them, we also need to tip our innovation system in a way that advocates for people and is inclusive for people and is not just driven by only corporate or only academic or only government interests. And probably the best example of this at a policy level is this idea of Open Innovation 2.0, which is a European level policy for open innovation. And this puts people right at the center. So it's about human-centered reflective societies and inclusive engagement of not only private and public stakeholders, but as citizens. And to embed those in the very core activities of research and innovation. Sometimes this gets referred to as a quadruple helix model, which brings together government, academia, business, and citizens into the innovation setting to work together. And it's building the connections between them that is one of the most important things here. And this is driving towards ideas of adoption. So again, we have lots and lots of things going on. We also, in some cases, we have lots of emergence of different complex things that are creating new, unexpected and unintended consequences. So our innovation needs to be responsive, and we need people to be able to adopt innovations. And as Michael Serrano talks about, innovation is not what innovators do, but what customers adopt. And the OECD came up with a value of 80% of the value of innovation comes from adoption. So the benefits of Open Innovation 2.0 are that we get scalable solutions faster and richer because we have faster innovation cycles that are inclusive of people all the way through. So because it's human-centered, we get better personalized and affordable optimized solutions. And as a service provider, service providers get to think about services in new ways, work with collaboratively with other groups and provide new services. And this Open Innovation 2.0 concept has grown up very much with the Living Labs concept. And Living Labs are basically, at the moment, the leading kind of platform, an open innovation platform that meets this kind of criteria. So if we're situating Living Labs, and if it's the only thing you remember about Living Labs, is that this idea of it emphasizes users as co-creators. And here what we're talking about is the users who are going to be involved in the use of the products or services. So if we're talking about an aged care centre, then that means older people, their family and their caregivers. And we're talking about real life settings. So we're talking about people's homes. It could be an aged care centre or something as broad as a smart city. And we'll see some examples as we go through. So I'm going to draw on some work by Dimitri Sherman, who talks about Living Labs and the three different kind of levels there are within a Living Lab. And this is partly to help for those of you who want to look up and research more. You'll see that a lot of the papers discuss Living Labs at these kind of different levels, but don't always. So you can think of this as a bit of an orienting framework. So at the macro level, we have an organization, which is the open innovation ecosystem that brings together those different partners. And over time, different people will come in and out as needed. But there is overall a clear strategic purpose and goal. And there are clear physical spaces and contexts and communities who are involved in the process and involved in the Living Lab. The organization can also provide technological support and various other kind of things like IP management and so on. Overall, it's an impact-driven organization, so it's about making changes, making innovation changes that are going to be adopted. The level below that, then we have the kind of programs of work. So engaging programs that look at specific areas of interest, and they provide the co-creation kind of tools and platforms that work across that program. Then at the micro level, we have the kind of projects, if you like. So this is where we're using co-creation methodologies, we're using specific physical contexts, and we're using the kind of iterative and agile methods in terms of being able to go from the idea and the initial concepts through to prototyping, final design, testing, and utilization. And it's about bringing together people as much as we can all the way through so that these views of the citizens, of the business person, or the government and the research component are all brought together as much as we can in each of these different stages. One way to think of about this is, if you like, is about market testing almost from the very beginning. So Living Labs worldwide, so the European network at the moment is probably the leading kind of network. They have strong connections into things like the World Bank and various other, into the EU. But as you can see, they're not just EU based. There are 3 Australian members, which are the Low Carbon Living Lab in Adelaide, the Transport and Logistics in New South Wales, and most recently the Future Self Living Lab at Swinburne in Melbourne. There's also Urban Living Labs, which are a different type of living lab, and there is a bit of an overlap, but the Urban Living Labs tend to focus more on transitions and architecture. And again, there are lots of those in Europe. And there are also other networks. So there's an African network, and we're starting to see some emerging networks in South America, Francophone networks, and sort of some of these overlap. So I'm just going to talk about a little bit about different types of living labs. And when we're thinking about setting up living labs, this is a nice orienting frame to think about which type do you think will best suit, and that will start to help you think about the different kinds of groups to bring together. So this again was based on work by Lemon and Westerland. The paper, you can find some of this on in Technology Information Management Review. So I've sort of chosen papers that are free for people who want to look up at that kind of level of detail. So on the right-hand side, we have inhalation dominated. So these are living labs that are more interested in the innovation being for those groups. So to take some examples, the utilizer-driven kind of concept is where you'd have a company, so that's coordinating the living lab, is bringing people into their business to help them develop their products and services. So this is more of a classic kind of open innovation style living lab. The user-driven living labs are ones where communities, so a bottom-up coordination approach, are coming together and looking at solving problems for their communities. So they're effectively doing it for themselves. These two are the ones where you least see the fewest of them, and the sort of fewest of them who become members of things like NL or the urban living labs. On the other side of things, we have probably where we'll see more living labs start, and where they're more familiar, certainly in Australia. So the provider living lab, now again, these are typically, not always, but typically universities or other educational institutions set up the living lab, and they provide the coordination and that organizational level structure, and they bring in other stakeholders into that structure, which could be local businesses, it could be government, but also the citizens and communities, and they're running the living lab on behalf of those communities. So effectively, the beneficiaries of the innovation are the communities themselves. In a similar way, we have the bottom-up kind of coordination approach. So again, what we have now is, again, it's typically, but not always, public sector, so maybe a government or local council, helping set up a living lab for to enable a community and those actors to come together for the benefit of that community. So these are two of the most common types that you'll see, and is a good starting place to think about living labs. So I'm going to run through some examples, and what we'll try and do is think about what this can mean for community care as we go through. So I'm going to start off with a couple of large scale ones. So the first one is, I'm probably not going to get this pronunciation right, but Kalasatama city, and this is in Finland. And this was a old suburb that was going to be completely regenerated. And so what happened was they had a Forum Valerium, which is one of the longest running living labs in Finland, auspiced the relationship between those different groups, and they asked, what's the objective? What's this kind of future vision that you want? And they said, well, what we want is an hour more free a day. And so the program of work, when they're thinking about developing the city, or this suburb, was all about giving people an extra hour. So some of that was, as you'd expect, maybe transport, but other things were, how can we make grocery queues shorter? How can we do other things that give people more time? Once the actual suburb was set up, one of the first things they did is actually set up the local living lab. So again, the different actors were brought together, and this is an example now of the project level, where in asking that community once it had built up, one of the things was really important to them was having advice around mental health issues and problems. And so they worked with a number of local businesses to develop this website around this kind of concept of asking an auntie telling you some answers for these kind of little everyday personal crises. There were also other projects around developing communities of older people who would exercise and be physically active together, but all those things were driven off the needs of that community. Another sort of large scale one is IMEC. So IMEC, previously known as iMinds, is based in Ghent, and they started off with a living lab to promote the development of startups and SMEs. So they recruited I think it was up to about 25,000 people in and around Ghent who would help and come along to workshops where their interests overlapped, and go through a living lab process with these startups to help them refine and develop their ideas. What that meant was, there's some interesting research they published, so they found that like over half of the people who went through that process in terms of the businesses changed their, had to pivot their ideas, had to change and adapt based on the feedback they got. There was about 15%, I think, who were told basically your idea is so bad you should just stop, which seems maybe a little bit cruel, but what that meant was that those people were not using capital on an idea that wasn't going to work. And many of them came back with a new idea later based on some of the feedback they had and some of the learnings from that and what they were doing. I think when we expand this and we start to think about what does this mean for innovation, especially when resources are scarce, this idea of having the early intervention, having people who you can engage with in a systematic way to understand whether these ideas need adaptation or whether these ideas are just no good, the earlier stage, the more capital we can save for investing in things that do work. As you can see, what we have here now is that they've expanded, and they are, and this is quite typical of living labs, that they'll expand and sort of start to network out, is they're working with Antwerp and Brussels on an Internet of Things living lab. And one of the key things, again, we come out here is we've got talking about 20,000 citizens. Now, 20,000 citizens are not all going to turn up to a workshop. They're too much British paper and post-it notes, but it means that those people can be involved at various stages of the project all the way through, in that from understanding their needs and their ideas to the kind of concepts, all the way through to a large scale involvement in the kind of final stages where we're talking about the sort of test bed approach. So the question is, I think for us is, if we're seeing this kind of scale of involvement, what would it mean for communities care services if we could have smart cities where there was that level of engagement, but also, or smart regions, but also where we deliberately had an inclusive agenda. So we deliberately had, we're including citizens with all the variety of different needs. What would it mean to how we could create and incorporate the kinds of services so that they are inclusive from the very beginning, not trying to retrofit it at the end? On a different scale, we'll talk about the Bristol Living Lab. So here, this was a much more small community, almost driven living lab. It was hosted, so it was a, I should just say, so this, sorry, the one above this was IMAC, and iMinds before it was a university conglomeration. So there was that sort of top-down coordination approach for the citizens. Here, this one is similar but on a smaller scale. So it was originally the Noel West Arts Centre. So it was that sort of academic institution, but quite small. And so the community engagement was, in this case, I think it was their second project, and their community said, we have a problem with damp. And so they created these little sensors that detected damp in people's homes, and then they published that data as a commons resource. And what that meant is that rather than the local council sort of seeing this as various individual groups, they now had data from that group that they could actually use to change policy. And so that's grown on to mean that the Living Lab is now one of the key areas the council goes to engage with the community and understand how to, for innovation processes and in community engagement. So the question is, what would be your frog? So what is the smallest thing that you could do in thinking about setting up a living lab to be able to experiment with this approach and produce something that maybe illuminates a problem, or is a small test small innovation, a small approach that gets started, because very often in living labs, they start off with reasonably small projects or ideas, and then they expand and grow. And there's a good reason for this as well, in that this is a different way of working, bringing together these different stakeholders. It is a different way of thinking about an innovation process so that you can be inclusive of people and give people empowerment as users, as co-creators, but also people can bring their own other perspectives from a research perspective or a design perspective or a business perspective to add to that, so that we are creating innovation that will work sustainably, not only environmentally, but socially and economically for everybody. And that takes a little while. So having these smaller projects where we can experiment with that and really build up that strong culture means that when you can expand, it's easier to do. Another little example of this is a living lab library in Barcelona. And here, this was a rundown bit of Barcelona. The university and a local library got together and sort of talked about setting up a living lab. Part of that was a makerspace as well. The community got very, very excited about it, and there was a debate over whether this was going to go ahead at the local council, and they all trooped off and made sure they got the funds. This is one of the outputs from it. So they worked, in this case, like an example project at the project level. They were working with a local storyteller, and they wanted to use some new ways of bringing stories to life. So in this case, the children were able to draw their own stories. They were able to create their own stories, and then they were able to capture their movements so that they could be put onto the animation of their own stories. Rolling 6 years on, this living lab, and the mayor who had to give the funds now has kind of gone up a level and had 200 libraries, and she was talking about, well, I want 200 living labs. And so whilst that wasn't a sustainable model and they've had to approach it in a different way, it's an example of how taking something small and getting really good in community engagement can lead to impacts where people want to have that kind of expansion. This living lab is one in Montreal, and I think the thing I want to draw most attention to here is the context, which isn't unfortunately obvious from this slide. So this is about rehabilitation and creating technologies to promote social inclusion and participation, but the place they chose was a shopping mall. So homes and offices and things are important, but this was a shopping mall. And I think one of the things that we can find really interesting about living labs, and one of the really big opportunities, is to take these different kinds of contexts and work with the innovations for people in those contexts. And there's a couple of other illustrations. In our last symposium, I was talking to a lady who was describing a young man who was asking for a particular type of wheelchair that would sort of elevate him. And the type he'd chosen was one where you had to stand up straight. And unfortunately, his condition meant he couldn't do that. And so when they had dug deeper, they found that he wanted to go to a bar and be at eye level with his friends. And so they found a different solution. But the idea of the context of the bar or the restaurant or the cafe, and looking at how do different innovations and what innovations are needed in those contexts, I think is a really important element of being able to get this kind of inclusion. And as another illustration, I was talking to someone who was talking about their father who passed away and how he loved to go to the theatre. That was his thing. And as he got older and he needed a walker, he had to leave the walker at the desk because the walker was too big. And so there came a point where he felt embarrassed or couldn't go. And unfortunately, that sort of signaled some of his kind of condition. His inability to socialize then deteriorated other aspects of his health. And I think this is really important. This is the stuff of life that we need to be able to be inclusive in all these different contexts. And a living lab approach is a great way of bringing context right into the center of the innovation process, so we can understand how innovations work deliberately in these different contexts to make them inclusive and to increase participation. There's a couple of living labs centered around aging. So the dementia one in Eindhoven, this is looking at using virtual reality for dementia patients as a method of soothing and calming. In Swinburne, there's a couple of here looking at apps and Kira to promote social engagement. And I think this is a lovely, again, twist on some of the technology. So for example, Kira, whilst we hear lots about what robots can do and how they could potentially replace people and things, here Kira is being used to basically create a social engagement through knitting. So as you can see, she's got her lovely, in this case, crochet dress through a knitting club that brought together different people in a particular community to knit for Kira. So they had a purpose, but it was about that social engagement. And I think one of the challenges for living labs going forward is to look at and one of the benefits of having a long-term living lab is to start to see how these things fit together. Because often we can measure first line orders of success, whether it's participation or numbers of people who've trained up in digital inclusion or something, but we know that there's a strong relationship between these different factors of things like digital participation, social participation, financial inclusion, and so on, that have second order impacts that are not easy to measure straight away. I think one of the great opportunities for Living Lab in this kind of area is to understand how we can make these different technologies, but also these different social interactions and place-based interactions work together. So we're working with a number of innovations in certain settings, in certain places, in certain contexts, and seeing how they fit together, learning from that over time, and we can start to measure the mix of social and economic and other benefits. So there are lots of other examples. So transport provision, Coventry, quality of life in Milan, and so on. So you can see that health is quite a big theme in Living Labs, and about 30%, I think, of the membership of NL over the last few years has been around health, well-being, and aging. So as an advocate for Living Labs, I think they are a great platform for enabling us to think about a preferred future that we want, and then having an innovation process that allows us to engage a network and a program that is human-centered and that involves people in that process of innovation to create the kind of future they want. It's naturally inclusive, it's focused on impact and adoptions, and emphasizes those elements of co-creation so that people have a voice throughout, and the real life context. So we're really working with the place, the people, and the culture in creating these innovations. As I mentioned today, I'm presenting on behalf of the Australian Living Labs Innovation Network. I'm delighted to be able to work with the other support of Data 61, Swinburne University, Western Sydney, and Sustain SA. And we're about the promotion of living labs and looking to foster collaboration opportunities in Australia and beyond, and building local capacity. You can find us at openlivinglabs.net.au. We also have YouTube and SoundCloud and Twitter. On the YouTube channel, you'll find a number of interviews from leading practitioners from Australia and around the world, giving you an insight into different examples of living labs, how they've set them up, the different kinds of methods they use, and there's more of those to come. And if you can also contact us on any of those email addresses you see there. So once again, thank you to Anna and her team for inviting us along today. And if you have any questions, please don't hesitate to contact us.
Thanks, Gareth, for your presentation today. That's a great overview of the role that living labs are playing and can play. I've got some questions coming in from the audience, and the first one's from Gemma, just inquiring about membership to the Australian Living Labs Innovation Network. Is there a structured membership?
We're just about to put on our website the membership structure. That's in sort of discussion with our board at the moment, and we hope to have that by the end of Feb.
And could you just talk about some of the activities that the Living Lab Innovation Network has been undertaking?
Sure. So we've had a couple of symposiums so far that have brought together people who are interested in living labs and want to know more about them. We'll be hoping to run another one later on in the year. We've been, as I mentioned, presenting at a number of places, but also interviewing people, practitioners from around the world. So we start to build up resources for people to use considering their own living lab setup. And on our website, you'll find a number of materials sourced locally and from around the world around, living lab materials. So how to set up living labs, what kind of processes you might use. We also, what else do we have? Yes, you also find some links into the Urban Living Labs group as well.
Thanks, Gareth. I've got a question from Courtney. Courtney's commented on your descriptions of overseas models where it's obvious that government policy might be encouraging the uptake of living labs. And she asks, have you seen any good examples of this in Australia where government policy at whatever level has been driving more living lab type engagement?
So yeah, I think there's a couple of points here. So in terms of living lab engagement and government policy, we're starting to see some interest. So the CRC for low carbon living, which is one of the living labs, has a government funding component. Local governments involved in the Future Self. We also know that there's in South Australia that they're going to launch a living lab where the government's been heavily involved in the creation of that. And there's also some CSIRO work around urban living labs that again has some government backing. I think what's maybe missing at a more generic level is this kind of policy view of involving people as a generic statement of how we should be approaching our innovation models. And I think here I interviewed one of the NOL council members not long ago, Juan Bertolini, and I think one thing he pointed out that's very important is you don't have to throw away all the existing innovation systems that we have. What living labs are is something you can add on top. And I think the way he described it, if I remember correctly, is it's like the turbocharger or the fuel injection. It's the thing you add on top that can leverage those existing innovation approaches and settings. So we have work that's going on in smart cities. We have work that's going on in various other kinds of arenas. And I think the thing that we can start to think about is how can we add a living lab to that to give it that extra boost, give it that tilt towards making it inclusive and having citizen participation so we can get better adoption and get better alignment with what people want in those contexts and cultures.
Thank you, Gareth. That's great. That's probably all the questions we've got time for today. But I'd just like to thank you for your involvement in today's webinar and the great content that you provided today.
Absolute pleasure, and thank you very much again for your support.
Thank you, Gareth. Before we end today's session, I'd like to let you know of some of upcoming events. Our next webinar is the 21st of February, 11 a.m. Australian Eastern Standard Time, where Dr. Ian Opperman will be talking about the endless possibilities of using big data to increase the quality and productivity of the community care centre. Further to that, we're later this year running a study tour in conjunction with the International Congress of Smart Homes and Health Telematics, being held this year in Singapore, and our study tour is going to be through Singapore and Japan. The theme of this year's conference is design, where participants will discuss their experience in design, development, deployment and evaluation of assistive and telehealth systems, as well as ethical policy issues. I'd encourage you, if you're interested in any aspects of this tour, which is also going to concentrate on living labs, please contact the team here at Community Resourcing. If you want some more information on the collaborative, in front of your screen there are the contact number, and you can send any questions or comments to sat@communityresourcing.com.au. Once again, I'd like to thank the members of the collaborative research team, the Queensland Government for its seed funding for the collaborative, and again, and especially today's speaker, Gareth Priday. Thank you, Gareth, and thank you everyone for attending today's session.